frontMIND is a study which targets patients with newly diagnosed diffuse large B-cell lymphoma. And it really builds on two pillars. One is that lenalidomide can be combined with R-CHOP therapy. This was so-called R-squared-CHOP. And R-squared-CHOP has been evaluated in two large randomized studies. One was robust, which unfortunately was a negative study, but showed feasibility of this approach. And the other one was E1412, which was the US intergroup study, was randomized phase 2, which actually showed a potential signal of benefit of addition lenalidomide to R-CHOP chemotherapy in all comers of patients with diffuse large B-cell lymphoma. Now, what has happened since, we also now have data that in the relapsed refractory setting, combination of lenalidomide and tafasitamab has a significant synergy and actually results in a great efficacy in relapsed refractory DLBCL, with response rates approaching 60% and quite a few patients achieving CR. What's also very important is that those responses are very durable, with excellent progression-free and progression-free survival and overall survival in those patients. So those two pillars led to development of frontMIND study, which it's really adding the doublet, so both lenalidomide and tafasitamab on the top of R-CHOP, and comparing it to R-CHOP alone or R-CHOP plus placebo in case of the study. The study is adding the doublet, so it's really focusing on the high-risk patients as defined by high IPI, 3 or more. And it's also looking at the patients with a short time from diagnosis to treatment. This is the first study, to my knowledge, looking at specific window of opportunity to enroll those high-risk patients with rapidly progressive disease, and allows only patients of 28 days from initial diagnosis to initiation of treatment. This is an ongoing study, fairly large randomized phase 3 of over 900 patients, and we hope that the study will complete its accrual soon, early next year, and then we'll await results.